Hey everybody. As you guys know, if you've seen my last video, I just had my 4th miscarriage in a row at 10.5 weeks. I know in my video I was pretty distraught. I don't know what possessed me to do a video that day. I shouldn't have. I mean, I don't know. I just wanted to get it off my chest, get it out there, and get everything over with. I know I also said I wasn't going to be doing any more videos. Of course, that was just anger and hurt and pain talking. Me not doing videos and being quiet isn't doing anybody any good. I mean, I need to talk about things, and if there's anybody out there going through the same things, I hope that my videos can help them cope and deal, maybe find answers for themselves. And hopefully one day down the line when I have my baby, it'll be inspiring for people not to give up, because my new motto is I'll stop trying when I stop breathing, so I will get my baby. I kind of wanted to go into detail about what exactly happened that day, and the difference between miscarrying naturally and having a D&C. I know a lot of my subscribers are currently pregnant. Please don't compare yourself to me. Like, if you're pregnant right now and you're scared of miscarriage, don't compare yourself to me. Don't say, oh, well, she had this, that means I must have, I have that too, that's going to happen to me. I'm not normal. I have something wrong with me. The doctor said that this is not normal and there's something wrong. So please don't drive yourself crazy and do that. However, if you are in the same situation as me or whatnot, then I'm sorry, and hopefully my videos can provide you a little bit of comfort or support or whatever. I don't know. So, my son's trying to sleep. Sorry, if you hear him on the baby monitor, that's why. Let's see, over the weekend, I think it was 10 weeks, 2 days, 10 weeks, 1 day, I don't remember. I tried with a Doppler. I think it was like 10 weeks, 1 day or whatever. I tried my Doppler at home, and I found the heartbeat after about 20 minutes. It was very faint. I had to push pretty hard, and it was a it didn't register on the actual Doppler, like the readout part. It didn't tell me what the beats per minute were, but when I counted them, it was about 156, I think, or 158. So I was so reassured and so happy. Later on, I tried to do it again because I was addicted to my Doppler, and this is really hard for me to say, and a lot of people are probably going to think I'm ridiculous, but I found the heartbeat again, and it was so faint, so faint. Like, it was hard to hear from all the static, and I wanted to hear a clear, beautiful heartbeat. So I pressed harder and harder and harder to hear it, so it could get louder. And I'm fairly thin. I don't have that much extra fat on me. So I'm fairly thin, and I actually felt a flutter because I was pushing down so hard. I didn't feel it from the outside. I felt the flutter from the inside. So it was me pushing down on my stomach hard enough for, I guess, maybe the nerves to feel around the baby. I don't know, but I've definitely felt a flutter. I mean, I've been pregnant before. I know what flutters feel like. I felt them with my son at 14 weeks. And I was like, holy crap. So I pushed harder. And heartbeat. But it was surrounded by a lot of static. Like the baby was moving or something. And then I heard this funky noise on the Doppler. And the heartbeat was gone. And I looked for it, and I looked for it. And I realized I had been searching for about 35, 40 minutes, and I still couldn't find it again. And when I took my arm off my stomach, my arm actually hurt. Like, when I took the Doppler probe off, my arm hurt, and I'm like, whoa, I was pushing hard. And I looked down on my stomach, and the area I was pushing had a red ring, and that red ring was there till the next morning. Now, when we went to go for our ultrasound, I was so excited. I had just heard the heartbeat a few days before. My baby was going to look like a baby on the ultrasound machine, on the picture. Like, I was so excited. My nerves were just, I didn't really have much at that point. My boobs hurt like crazy. They had grown. I was pouring out of my C-cup bra. Like, overnight, my boobs grew. Everything I thought was perfect. I get into the ultrasound room and the doctor comes in, because the doctor's always the one that does the ultrasound, and I tell him, like, about the Doppler, and I'm like, I'm really kind of worried about that. He goes, you can't hurt anything. I was like, no, I was pushing pretty hard, and he goes, no, you can't hurt anything. So he does, and he goes, well, if you could hear your baby with the Doppler, we could probably do an over-the-belly ultrasound. I'm, okay. So he tries to do an over-the-belly ultrasound, and his machine's pretty old, and I'm looking at the screen, and it was so hard to see. And he takes it off almost immediately after he puts it on. And I should have known, like, the tone of his voice that something was wrong. But he just said, let's do a transvaginal. I'm not getting a good picture. And I'm like, okay. Like, I was happy with that. I wanted a better picture of my baby because I was going to announce it that day on Facebook to all my friends. You know, I've been waiting since December to announce a pregnancy, and I've never been able to. I've only announced my first miscarriage on Facebook. And then the other two I didn't announce. I just suffered, you know, in silence, I guess is what you call it. But October is Pregnancy Loss and Awareness Month, and I happen to have a miscarriage in October, right? So I did post something saying that October's also Breast Cancer Awareness and Pregnancy Loss Awareness Month. And I did state then that I had lost 3 babies. So I kind of put it out there that way. A lot of people are like, don't announce your miscarriage on Facebook. That's kind of tacky. But why not let them be known? They were my babies. They were alive. Those lives were given to me. So I'm not going to be quiet. I mean, if there's somebody like crying at home because they had a miscarriage and they don't think that they're too embarrassed to tell anybody about it, you need support. I mean, I would not be able to function if I didn't have support from my husband and my friends and my family. And so I know I'm going off on a tangent here, so let me go back to the ultrasound. So the doctor does the ultrasound, and I see it the second, well, I guess I don't see it the second the baby's on the screen. Like, it was boom on the screen, and I don't see any movement. And I just go, oh, where's the heart? I'm like, where's the heartbeat? Why isn't the heart beating? I'm like, is this a picture? Did you just take like an instant picture, or is this like in real time? And he didn't say anything. He's just saying, hold on, and he's zooming in and zooming in. And the other doctor that was with him ran and got the tissues. And when she did that, I mean, you just know. I mean, I knew before she even got the tissues. And I didn't need the tissues. My husband ran over. Like, I don't even remember. I just remember him being right there next to me, because he was on the couch with my son, because I have a little couch in the room. And he was just over there holding my hand, and like, I couldn't feel anything. I can't even explain it. Like, I couldn't feel anything. I had no feeling. I didn't feel happy. I didn't feel sad. I didn't want to cry. I didn't want to scream. I just laid there and felt empty. Like, I didn't have a broken heart. My heart was just gone. It was completely gone out of me. I have never felt anything like that, ever. So they take my son out of the room so me and my husband can have a moment, and I wanted them back in the room. I wanted to talk to the doctor, so that was kind of like, all right, come back in, give me my baby back. So, I mean, that was nice of them. I'm not saying anything bad about that. So they come back in, and Logan looks just so distraught. I mean, he's like, what's wrong, Mommy, you know? And the other doctor, the female doctor, hands him to me, and he just cuddles with me, and then I start crying. I just start, like, just would not stop. And he leaps over and goes to my husband, and he turns around, and he looks at me and he wipes my tear away and he says, "It's okay, Mommy." And that even like choked up the doctor. He was like, "Wow, you have a really special little boy." And I'm like, "Yeah, I do." So that night I did announce to everybody, my friends and everything, that I just had my 4th miscarriage, and most people are supportive and sympathetic and nice. If you're going to announce your miscarriage, it's great to talk about it, and it's great to acknowledge what happened and have support. But just prepare yourself that there are insensitive people out there, and there's people who don't know how to act. It might make people uncomfortable. It might, people who've never experienced it just don't know what to say. So, just try not to take things to heart too much. I know that's really hard, but, what shocked me was there was a friend of mine who's had 2 miscarriages, and she's currently 33 weeks pregnant, and she sends me a personal message saying, "So sorry, hope you're doing okay. I have a quick question," and started asking me a question about pregnancy. And it's like, really? I just lost my baby, and you're going to ask me a question about your baby? So, it had to do with her thinking she lost her mucus plug, and if that means labor's imminent. And I mean, I try not to be a bitter person. Like, I'm happy for all of my friends. I have 9 friends right now that are pregnant. I'm happy for every single one of them. But you don't ask somebody that who just found out 2 hours before that they just lost their baby. So I did have a bitter response back. I said, "Hell if I know, go ask your doctor." And then she wrote back, "You okay?" So, like, if you're gonna talk about your miscarriage, expect a little bit of insensitive people. And also, if you've had multiple miscarriages and you announce them, I know I've mentioned this before, but a lot of people think, "Oh, you've gone through 1, I'm so sorry." 2, they're like, "Oh, again, I'm sorry." 3, it's like, maybe you should give it a break and stop trying. And 4, it's like, maybe you need to think of adoption. Like, people seem to get desensitized by it, and they don't understand that each and every loss hurts worse than the one before. People think, "Oh, you've done it before. This has happened to you before. You lived, you survived," but it kills you every single time, and you can only take away so much of a person before they lose it. So, let's see what else. Oh, so when the doctor came back in, I begged him for a D&C. And I want to talk about the difference between miscarrying naturally and having a D&C. So, first of all, I'll talk about my miscarriages. Sorry, I'm like repositioning myself. I'll talk about my miscarriages and how mine always start out, and they always start out with brown spotting. Now, every person I've known, except for one, so it's my sister, 3 of my friends, my cousin, all of them have had spotting during their pregnancies, and every single one of them was fine, except for one other friend of mine. So, my miscarriages always start out with brown spotting, and they tell you if it's brown, it's fine, it's old blood. Not the case for me. I'll try to make this quick. It's hard miscarrying naturally because mine start out with the brown spotting. I go in for ultrasound. I see my baby has a heartbeat. For a week, I don't know if I'm miscarrying or not. It's completely stressful. I go in for another ultrasound. Baby's there. Baby's fine. And then, a few days later, I'm still bleeding. And then I end up passing the baby. And then I go in for confirmation. And then I'm bleeding for 2 to 3 weeks afterward. And every time you have to go to the bathroom to change your pad or go or pee or whatever, and you see that blood, it's just a constant reminder for 2 to 3 weeks that you're not pregnant anymore and you lost your baby. And having to see your baby come out, that's a natural miscarriage. Mine apparently have been different from the norm. I don't have cramps with mine. with my third miscarriage, I had slight cramps, but I wouldn't even call them cramps. I mean, it was so slight. I think once I was like, oh, this kind of hurts, and then that was it. And also, miscarrying naturally, you don't know where you're going to be at when you pass your baby. It's a process. It's not like, oh, I miscarried on this date. It's a process. Like, you know, my first miscarriage started on February 7th, and I passed the baby on February 14th, and I didn't stop bleeding until like the 21st or something like that. So it's a process, and you don't know where you're going to be, and life goes on. You have to get up and function and do things, and with my third miscarriage, I was taking my son out to lunch. We were in Moe's barbecue. I was trying to breathe and function, and we decided to go out to lunch. I really didn't think I was going to pass the baby right then and there, and I felt something. I go to the bathroom. That was probably the most blood I've ever seen in a miscarriage that I've had. And I'm in a bathroom, like a dirty barbecue place bathroom. And I don't know what to do. I don't want my baby. I'm sorry if this is graphic. Like, I'm going to talk about graphic things, but I don't want my baby falling in this dirty toilet. It's my baby. Like, yeah, my baby might only be this big, but it's still my baby. So I reached under there. I caught my baby and, wrapped it up in toilet paper, tried to clean myself off as good as possible. I had my son's diaper bag, which is a backpack, so I was able to put that on, and it covered up my shorts so you couldn't see the blood. 'Cause for some reason, the blood came like up on the back side, like not underneath in your crotch area, but in, like where your butt is. I think it was because the way when I took my pants off, it kind of just like gushed. So, you know, got a cup of ice, and I'm crying, and the lady behind the counter is looking at me. Why are you crying? Asking for a cup of ice. And I put my baby on that and go home, and I have to bury my baby. So that's the hard part with miscarrying on your own. It's just seeing everything and not knowing when and where and how things are going to happen. Hold on. I actually found the process of a missed miscarriage, which is what I had, not easier to deal with, but easier to accept, I guess, might be the right word. So I went in, I think I was 10 weeks, 4 days, and the baby looked like it had passed at like 10 weeks, 2 days, or 10 weeks, 3 days, so it had just passed. And like I said, I begged for a D&C, so he scheduled me the next morning. I get to the hospital around 6:30. All the nurses there were so nice and empathetic and sweet, and I had to register. So I go in to register, and if you see me smiling a lot, it's not because I'm happy, it's because I'm going crazy. I'm smiling because if I don't, I'll cry. And I don't want every video of me being crying, you know. I don't want every video to be of me crying. So I go in to register, and the lady behind the counter was about 8 months pregnant and big and beautiful and just had a gorgeous little baby bump. So I'm filling out the paperwork, and I couldn't keep it together. I'm just hysterically crying, and she was very, like, to the point, like, okay, this, you know, doctor bills, anesthesia bills, just, like, reading everything kind of like a robot, like, you know, it's her job. And then out of nowhere, she comes around and gives me the biggest hug ever. And, like, I think she was crying. I can't tell. But she said, I am so, so sorry. I've had to have 2 D&Cs myself. And then I said, well, this is my 4th miscarriage. And she just was like, you could feel that it hurt her. So I really appreciated that. Like, even though she was pregnant, and it hurt me to see a pregnant person when I'm getting my baby taken out of me that had died, it was still nice to be acknowledged, I guess. So after I register, I I go back and sit with my husband and my son, and they call me back, like, within a second of me being back, like, sitting down. So I freak out. I'm about to, like, be put under and go through surgery. Like, I freak out. So I hand Brian all of my stuff. And my cell phone, my wallet, everything. And I go back there, and then I realize sorry, my hair is driving me nuts. I realize I'm only back there for prepping. And, after about 30 minutes, they're like, do you want me to go get your husband? I'm like, yeah, please. I'm lonely back here. I'm terrified. I'm upset. So they go to get him, and he'd left. Obviously, a hospital is not a place for a 2-year-old. And he actually was picking up my mother-in-law from the airport. So he was picking his mom up. She decided to come be with me for, a week to help and everything around, which was amazing. Absolutely amazing. So, my surgery was scheduled for 7:30, and they tell me that he had an emergency, and the surgery would be pushed back, which is fine. I mean, I hate to hear an OBGYN has an emergency. I mean, that has to do with somebody else's baby, so that made me cry even more. And then it was 8:30, and they came in, and they just said he had one more emergency C-section, I think. And they said that it would be pushed back a little further, which is fine. Like, my baby's dead. Like, go save somebody else's. So I was fine with that. I was just really lonely with nobody there. And, I've been there since 6, and it's already after 8:30. I'm just laying there alone. I was in a gown. My hair was in that ugly blue net. I had on compression garments on my legs and the blue hospital socks or whatever. I had the IV, which, can you see that dot right there? That was the most painful IV I've ever had, which I'll tell you that in a little while. Let's see what else. Oh, okay. So then the lady felt really bad for me, so she's like, do you want some Valium? And she goes, just to help you relax, because I guess I was hysterical. I mean, who wouldn't be? And I wouldn't do it. I just said, I can't do it knowing, I know my baby didn't have a heartbeat yesterday, but what if a miracle happened? And so they wheel in an ultrasound machine, and I got to see my baby again, and there was no heartbeat, but I got to see my baby, and I got a picture. And then I got the Valium. And then everything was fine. The room was beautiful. The nurse was beautiful. Her hat was beautiful. The ceiling, everything was beautiful. So, once that kind of wore off a little bit. They had to give me oxygen because they said sometimes when you have... Okay, sorry. I'm smelling something funky, and I don't know if my dog's did something... But they said sometimes when you have, get relaxing medication like that, sometimes you don't breathe, so they gave me oxygen. Then the doctor comes in, and then they can't get a hold of my husband, because they called him to let him know that the surgery was pushed back, and they couldn't get a hold of him. So he must have been driving or something, I don't know. So then the doctor comes in, and he says, right, we're ready for surgery and everything, and they wheel me into the OR. And the OR was a lot bigger than I thought it would be. It was, of course, stark white, just like in movies. And I've been in an OR before, but I was kind of freaking out when I was in that operating. I had a cyst on my head that I had to get removed, and completely different circumstances, so... this room's a lot bigger, but I know that's completely irrelevant. I'm just rambling. But anyway, we get in, and I see like these big lights, and there's other people in there that I hadn't seen before, and they're all wearing masks, but you could see in their eyes that they genuinely cared. Like, I know if you watch a lot of doctor shows, and a lot of the nurses and doctors seem cold on the show, but no, not where I was at. Like, you could see empathy and compassion and love in their eyes. Like, I can't even explain it. Well, I guess maybe I did explain it. But I remember looking at this one lady. She had dark hair because it was peeking out of her hat, and she had on a mask, and I think she was the anesthesiologist, but I'm not sure. And she holds my hand, and I'm literally shaking. I'm shaking so bad. And then that's all I remember. So I woke up in recovery, and my throat hurt really bad, and I could barely talk, and they said that's because I had a tube down my throat. Because I was put under. And I kept waking up and going back to sleep, waking up and going back to sleep. And then finally when I was awake, they had me stand up and go to the bathroom and get dressed. And then I just, the nurse was nice enough to give me my own private room to just sit. Like, there was no bed in there, but there was a chair. So I just sat there, waited for my husband to come, which he actually was there within about 15 minutes, I think. So I was pretty drugged up that day. Now, what do I think is easier, a D&C or a miscarriage or natural miscarriage? I actually think the D&C is a lot easier. For recovery, I'm sorry, I'm jumping all over the place. For recovery after the D&C, I did not look up anything about it. I knew nothing about it. I just jumped into it out of complete just despair and grief, I guess. I guess they go in and they, you know, kind of like when you get a pap smear, they put that thing in and open you. So they open it up, and I guess they take a tool and they kind of open your cervix, and then they've got this like little spoon-shaped device, and it just scrapes your uterus, and it scrapes out the contents of your uterus to get the baby out. And I am getting testing done on the baby, and we've opted to know if it's a boy or a girl, so I can finally name this baby, because I have a lot of guilt that I can't bury this baby, that I gave it away and it's just going to be dumped in some biohazard container. So I think out of respect that this person should have a name and I should know. I'm sorry. So I'm looking forward to that call, and I'm dreading that call all at the same time. Anyway, back to recovery. So they told me that I should experience some, you know, light bleeding and spotting for a day or two, and then that should be it. So I bled pretty heavy the first couple days. I really didn't have any pain physically until day 3 or 4. I think it was day 4. I was in pain. It was like a contraction or a cramp. It was in my back and in my front. I couldn't tell if I had a bladder infection. I couldn't tell if I had a uterine infection. Excuse me. I had no idea. And it also felt funny to pee, so I just thought that's a bladder infection. I didn't know that they gave me a catheter. I mean, it makes sense now, but I didn't know. So I called the doctor and I told him I was in a lot of pain, and they did prescribe me an antibiotic. A really strong one. I only had to take it for 3 days. And that day, it was hard to move my legs. I just laid on the couch. My mother-in-law took my son outside to go play, and I thought some fresh air and sunshine would be good. So, I went to go outside, except I had to pee. So I went to go to the bathroom, and I was cramping so bad. And when you push to pee, I mean, you push down there. So I felt something come out, and it was actually 5, I counted, 5 blood clots. The biggest one was probably about that big, and then they ranged in size. And some lining, like there was some like tissue, I think, of my lining. And after all that was out, this cramp stopped. So I know that's what it was from, which is really odd because I've never really had cramps, you know, since I've been in labor. But I'm sure it was from the D&C, you know, really scraping stuff up in there. And then, I mean, the bleeding pretty much stopped. I have had a liner on for the last 2 days. Today, I don't even think I need the liner. I just have it just in case. My arm's hurting. So, that is my story, I guess. I was prescribed Xanax, and I took it for the first 2 or 3 days, and then I haven't needed to take it since. I'm trying coping techniques. I can't really tell you how I'm coping. I really don't know. I really, really don't know. I have so much hope, and I think that's the only thing that's getting me through is knowing. I know I'm gonna have a baby. I know it. And I just cannot wait for that day when my baby is put on me. I know it'll be worth it in the end. All the heartache and the pain, and I know. Of course it will be, it's my baby. They are going to do more testing on me. The doctor thinks that I just didn't have enough blood thinner. He thinks I might have a blood clotting problem. Yeah. So we're going to get testing done. If I do, I'm going to have to get daily shot injections of a blood thinner, which I'm fine with. I'm perfectly fine with that. Give them to me. I mean, I will wear those bruises proudly. Sorry. As for coping, everybody copes in their own way. You can be angry, you can be sad, you can have no emotion. I cried all day yesterday. All day. And today I've actually managed to not even, a tear hasn't left my eyes. They form, but they have not dropped. And I'm gonna be okay. So that's good. And surprisingly, I'm excited to start trying again. Because I guess with each pregnancy is a new hope. And I'm excited to find out the reason why this is happening. I don't know what's driving me to be excited, but I guess love. I don't know. Sounds kind of cheesy. Anyway, that's my story. I thank you all for your support and your kind words, and this was such a complete shock to me and my doctor and my husband and my family. Like, I think maybe I'm in shock still. I don't know. It's just, everything is just so surreal. I just want to find out why. I want to honor my babies. I want, more than anything, to have another child of my own. And this whole process has made me realize that, like, how precious my children are. Like, I mean, I knew it before, but you really don't understand, like, how delicate of a balance it is to make a baby until you can't. It's just amazing. Absolutely amazing. So anyway, guys, for all of you that are pregnant, I wish you so much luck. Hope you never, ever, ever have to go through a loss. For all of those of you trying to conceive, I wish you lots of luck as well. And again, I hope you never have to go through a loss either. If you do, I'm here for you. Please feel free to personal message me or anything. And I will be doing a video updating you on the testing results back from the baby. I'll update you on the baby's name. I'll update you. I'll just keep on updating. Why not? So anyway, I'm just rambling and I should end the video. So again, thank you guys for everything, and hopefully someday very soon I get to do a video of the birth of my baby. My live baby in my hands, in my arms. I cannot wait. It'll be awesome. So, alright, thank you guys. Love.